In this video, I'm going to answer a question I'm asked very often. How do you know if you have visual snow? I'll walk you through what visual snow looks like, the range of visual symptoms people describe, and the next steps if you think you have this. So let's get started. What does visual snow look like? The terms people have used include the word visual static or visual noise. It's the sensation where people see across the whole of the visual field a disturbance, like dots across their whole vision. Some people use the words like a pixelation. People described it as having a fog that they're looking through all the time. It's almost as if there is a grainy filter in front of them. Other words that people have used to describe it to me include a fizziness, a sense of something doesn't feel quite right. It's all moving or shimmering in some way. You may have heard it classically being described like out-of-tune analog television. And it may be that you are not old enough to have seen an analog television to know what it looks like out of tune. Other words include pixelation across the whole of the visual field when things are not quite sharp. This static or dots across the whole of the visual field does feel different for various people. The most common thing that I've heard, it's like a little translucent effect. For some people, it's more of a grayish, a whitish, and it could also have colors within that. The colors of the dots itself, the whole static and the dot, may sometimes change depending on the background that somebody's looking at, or sometimes to do with the background lighting condition. Sometimes people use the word that their vision feels fuzzy. It's not quite clear somehow. And this thing could be temporary. Seeing visual snow may actually be part of a normal visual experience. You may have heard people use words like, oh, I'm quite tired today, my vision's a bit fuzzy, I've been using the computer screen all day. Or somebody's very ill, maybe they say, oh, I'm feeling quite ill, I got a flu and everything's just a bit fuzzy. That description of the word fuzzy, if we explore it a bit further, does sound like a milder version of visual snow. But in those situations, it would be temporary. I mentioned about certain situations that bring out the snow. People have told me it could be in very bright light, it could be in darkness, or even for some people, it's somewhere in between. So I think that is quite an individual thing. I talked about how it can be temporary, but when it becomes permanent, it could be part of this condition called visual snow syndrome. In visual snow syndrome, there are also other associated visual symptoms that come with this. Here are a few examples of the visual symptoms. Persistent after images is quite a common one. For example, when somebody's looking at an object and then when they look away, the object still stays in the part of their vision where they were looking at it. It's almost like if you're taking a picture using the camera and you still get the after effect of the picture, it still stays within the vision. Or if you had a picture taken of you and you get a flash, it's kind of like getting the after effect of having the flash in your eyes. You still see that flash. The other symptom, trailing of images. So that is a sense of there is a tail behind something that's moving. Another way to think of it is like seeing a long exposure photograph where you can see a moving object still with that trail behind it. People may have a sense of seeing double. Or sometimes it feels like a ghosting of an image. So if they're looking at one object and then just immediately next to it is just a subtle separation of that, a ghosting of the image. Some people get a lot of floaters. Floaters could be normal as part of just how our eyes are structured, because that would come from the jelly within our eyeball itself. It's not uncommon for people to notice a floater here and there. But in the condition of visual snow syndrome, there's oftentimes a troublesome observation of a lot of floaters. It's more than what we would expect when we examine somebody's eyes. People often get what we call blue field entoptic phenomenon. Entoptic phenomenon describes visual symptoms that come from the structure of the eyeball itself. On the retina, which is at the back of our eyes, we have blood vessels that is on top of it. What people see is that the blood cells inside the vessels moving. When people are looking into the sky, for example, or into a bright wall. They see this branching of the blood vessels, and within that, the cells moving. It's almost like I see a web or a tree branching effect, or some people say, oh, I see a little thing floating off quickly. Those are the kind of examples of experience of blue field entoptic phenomenon. Again, that could be part of a normal visual experience. Very common for people who don't have visual snow syndrome. When they look up into the sky, they can probably see a little bit of that. But it becomes problematic and part of this condition of visual snow syndrome when it's persistently there or becomes much more troublesome. Other things include shaking of things that they are looking at. This may be more obvious if there is a high contrast to the object. For example, if there were lots of black lines on white background and increased sensitivity to light. This could come across as people needing to wear sunglasses because it's too uncomfortable when they go outside, or sometimes even indoors, they feel really uncomfortable with the light coming through the window or even the indoor lighting. Some people have talked about how this is more troublesome with different types of lights. For example, LED lights compared to fluorescent lighting, and I do see a variation of this. Night vision can become problematic, and this is related to the snow itself, the visual snow or visual static, just causing a whole obscuration of dots across the whole of the visual field. People describe it hard to see contrast because of the presence of the static all the time. I hear the impact of this difficulty in darkness in various scenarios. For example, I hear parents talk about how if they are going to check in on their children and the room is really dark, it's really hard for them to see the features of their child's face because of the darkness and the interference of the visual snow, making it hard to see the contrast. Some people tell me that because of this impact of the darkness and the vision experience, that they don't really go out at night. There are also other visual symptoms that come in darkness. Some people see a lot of halos with the street lamps or with the car lights. It makes them feel really uncomfortable. There's a starburst effect. It's almost like you see a star coming out of where the light source is, or you see a halo around the lights. So those symptoms can also be rather problematic. When visual snow comes with a variety of other visual symptoms, this could be part of a condition called visual snow syndrome. Visual snow syndrome is a neurological condition where the eye health itself is fine, but it's related to how the brain is processing vision. There is a diagnostic criteria to this, and it requires the presence of the visual snow across the whole of the visual field for at least 3 months, plus at least 2 of the visual symptoms, some of them which I've listed. In my medical and research work on visual snow syndrome, I've seen people develop different parts of this at different times. It may be that they first start seeing a lot of after images or a lot of floaters, and then later on they get this static across the whole of the visual field. So I would say that some of the symptoms may be more prominent than others, and sometimes the static or the snow may come later than other visual symptoms. There are also non-visual symptoms that come with this, and I must say that this has to be listened to very carefully. I feel a lot of empathy for people who come to see me, and when they share about their visual symptoms or their non-visual symptoms, they often feel very moved to tears because they don't share it with others, thinking that by talking about it, they may come across as being weird or crazy. Some of these visual symptoms include feeling depersonalized, separate from the surroundings. It could be just this sense that they're not quite there, so this disconnected feeling. People may also get some sensations felt in the body, and this could be some tingling, which may come and go. And other things, people have talked about tremors, little tremors that they feel. High-pitched tinnitus is quite a common one, but again, it does not mean that somebody who has visual snow syndrome will need to have all of these symptoms. Headaches are also quite a common combination with visual snow syndrome, and this may even be a problem with migraine rather than just a head discomfort. Other non-visual symptoms that come with visual snow syndrome may include discomfort or pain in the body, fatigue, tiredness, a sense of fogginess in the brain or brain fog, difficult to process information, finding that their memory is being affected. People's moods are oftentimes affected by the condition itself, which is very understandable. If you can imagine, if somebody's living with a lot of disturbance in their vision all the time and having to push through, and sometimes even having to feel like they have to act normally, this really takes a lot of internal effort. This is linked with people being really tired and fatigued. Therefore, this is something that we need to be aware of to support further. Anxiety is also very understandable. It could be a separate thing that somebody else suffers from called health anxiety. That is something also we need to support through. The key thing to say is that I think we need to have an open mind as a medical and research community to hear the experience of people who are suffering from this condition so that we can properly understand the range of experience with this. And I'm certainly continuing to do active research in this area to be able to share this data and to be able to advocate for people who have this condition so that they get diagnosis earlier to then lead to further support and treatments. If you are listening to this and if you feel like you have the condition of visual snow syndrome, I want you to have some hope. When people come and see me in my clinics for the first time, they worry that they're going to go blind or they have to stop doing what they love, they're going to have their careers affected, and so forth. I want you to know that in my experience, there's a whole range of these symptoms. For some people, it could be very mild and it could stay that way and even improve over time. For some people, it's much more severe and they may need more intensive support. And even in those situations, there are ways that we can help people get better. I want you to know that if you have visual snow syndrome, you're not going mad, you're not going blind. It's all part of a brain network processing of the visual symptoms. The key thing though is to make sure that you get your eyes tested, where necessary, get a neurological assessment. And I have done a video about how to test for visual snow syndrome, which I'll link to somewhere around this description so that you can get further support. Feel free to put in the comments what you would find helpful for me to share further. I'm going to start to put some videos of practical resources and things you can do in a playlist. I'm new to YouTube and all this is actually quite a big learning curve for me, but I'm here to help. So please check out these links and resources and tell me how I can help you further.